All right, we are going to go ahead and get started. So good afternoon, everyone. Welcome to today's multidisciplinary information session on FERPA and HIPAA. My name is Erica McAllister, and I serve as the School Health Services Liaison with the Nevada Health Authority. And today we're going to walk through how these two important privacy laws apply in school settings and what that could mean for your day-to-day work. Before we dive in, let's look at our session objectives. So by the end of the session, I'm hoping that you'll be able to clearly explain what FERPA is, what HIPAA is, and how each applies in a school setting. You'll also understand why these laws matter for student support, practice applying them in common scenarios, and review best practices that make compliance easier while still allowing collaboration. These objectives will guide us through the rest of today's session. All right, what is FERPA? So FERPA stands for the Family Educational Rights and Privacy Act. It's a federal law that is designed to protect the privacy of student education records. FERPA applies to almost all public schools because they receive federal funding. And under FERPA, parents have certain rights related to their child's educational records until the student turns 18 or enters college. In schools, FERPA covers records kept by teachers, school nurses, school psychologists, and administrators. What FERPA doesn't cover is the healthcare providers who are not employed by the school. So this would be like a private community pediatrician, for example. Schools generally need written parental consent before sharing information on their students, with a few exceptions. But the bottom line is that FERPA is our school privacy law. And now what is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act. This law protects the privacy and security of health information. It applies to healthcare providers, health plans, and clearinghouses. In the school context, HIPAA usually applies to providers who are external to the school, like community health clinics or school-based health centers. If a provider is employed by the school system, FERPA, not HIPAA, applies. HIPAA does allow information sharing without consent when it's needed for treatment, payment, or healthcare operations. So we can think of today HIPAA being the healthcare privacy law. So now, why does this matter? And especially in the school setting, understanding the differences between FERPA and HIPAA is more than just a compliance piece. Protecting student health information is critical, but sometimes people overinterpret the rules and default to, well, we can't share anything. And which can actually undermine the care coordination that could prevent students from getting the support that they need. So by clarifying these rules, we can better support whole child wellness and make sure students don't fall through the cracks. There it goes. Okay. So this slide shows a quick comparison of FERPA versus HIPAA. And the key takeaway is if the health provider is employed by the school, then FERPA applies, even if they're providing health services. And when it comes to sharing information, FERPA requires parental consent in most cases, but there are exceptions for health or safety emergencies and certain official purposes. And HIPAA requires patient and parent consent too, but it allows sharing without consent for treatment, payment, operations, emergencies, and mandated reporting. So while the laws are different, they both have some built-in flexibilities to support student care. Okay, so what law applies in schools? This is one of the most common areas of confusion that we've seen of which law applies in the school setting. The key distinction here is going to be employment. If a health provider is employed by the school, for example, a school nurse, school counselor, or school psychologist, then FERPA applies, even if they're providing health services again. And on the other hand, if the provider works for an outside clinic or organization, then HIPAA would apply to their records. So a student may have both sets of records in different places, which is why understanding this distinction is so important for coordinating care in schools. Okay, so next, let's talk about what information can actually be shared. Under FERPA, you generally need written parental consent, but there are important exceptions like I mentioned. You can share without consent in a health or safety emergency with school officials who have a legitimate educational interest or under certain legal exceptions like audits or court orders. For HIPAA, consent is also the baseline, but sharing without consent is allowed for treatment, payment, healthcare operations, and emergencies, including mandatory reporting. So in both cases, there are guardrails that allow information to move when it's really necessary. All right, we are going to look at two common scenarios here and break them down a little bit. So scenario one says, can a school counselor and a visiting therapist from a community clinic share notes on a student? This answer would depend on who employs the provider and where the records are kept. So FERPA might apply, HIPAA might apply, or both. And in many cases, you'll need parent consent, or you might already have an MOU in place through the school district that can govern this kind of information sharing. Scenario two is where a parent asks for their child's medical record from the school nurse. So in this case, we would see FERPA apply and not HIPAA. And so the school must follow FERPA rules about access and timelines for getting this information to the parent. Okay, I thought it would be fun to do a little bit of an interactive piece with polls. I have not done polls in Teams yet, so bear with me to see if this will work. I am going to launch it once it loads. Basically, you guys are going to mark true or false for each of these statements. Okay, it looks like it's up. So number one, true or false, HIPAA doesn't apply to most school staff. And I'm not sure if it will let me show the results. before we go to the next one? All right. This one is true. I'm going to have to close this. Okay. So the correct answer is true. Most school staff fall under FERPA, not HIPAA. Which could be why you may hear that HIPAA is less relevant in the school setting. And please raise your hand or just speak up if the poll is not working for you. But I believe it should be showing number 2. So true or false, HIPAA prohibits all information sharing. Okay. And the answer is false. HIPAA actually permits information sharing without consent in certain cases, like treatment or emergencies. It's not about shutting down all communication. Okay, and the next one we have here, it says true or false, schools can't talk to outside providers. Okay. And the answer here is false. Schools and outside providers can collaborate, which is something that Nevada Medicaid definitely encourages, and it's one of those long-lived myths that we're trying to dispel these days, that the school services can complement services that are occurring outside in the community. And then for these situations, that's where MOU may need to be in place. That way there's processes and clear communication that can occur. Okay, on to the last poll question. True or false? FERPA allows sharing for school purposes with limits. I'll give you guys a minute to answer. All right. So the answer for this one is true. FERPA does allow information to be shared within the school when it serves a legitimate educational purpose, but it also sets some boundaries to ensure privacy for our students. Okay, now I'm wondering if I can share the results. Just to see how we did. All right, 88% of us got number 1 right. Sweet. Looks like 100% of everyone got number 2 correct, and number 3, and number 4. Awesome, cool. Okay, I'm going to switch back to the presentation. Bear with me, it's slow. And we will be going here. All right, thank you guys for your participation. Hopefully that went smoothly for your end too. Okay, moving on. Let's walk through some best practices listed here. So these are some of the top strategies that have been provided from the School-Based Health Alliance. These are strategies that schools and districts can use to balance compliance with practical needs. So, for example, one best practice is having a clear FERPA compliant release form on file. And this is something that NDE has actually been working on putting out a new, like, streamlined FERPA compliant release form when it comes to Medicaid billing. So that's really exciting. We'll be able to share that after this webinar. And then we have making sure that staff know the difference between FERPA and HIPAA so that, you know, they're not automatically defaulting to, oh, well, I can't share this information. Because like we talked about before, that could be a detriment for our students. And training and communication can go a long way in reducing confusion. So if any LEA admin people need support in that, we're definitely happy to provide information or even the slide deck. It should be on our website later with all of this information. Okay. There's that quick tip for the FERPA compliant release of information. And this type of release can make collaboration much smoother between schools and outside providers. And so that's something that we're going to encourage in collaboration with NDE for that one. And also, the benefit of having this new one is that, say a student is, for example, in Washoe County and they get this consent for billing Medicaid. That type of consent is like a one and done. So it's like the golden ticket. I've heard some LEAs call it. Like once they get it, they're really happy. But if that form is specific to Washoe County or wherever they are, and they move to a new county, that consent would need to be updated and regained. So this new form is providing coverage through the whole state of Nevada with all the school districts and LEAs participating in Medicaid billing. So that should be really helpful. And
Hi, Erica. This is
Hi.
Sharon from CCSD. So it's my understanding that we worked a couple of years ago with Nevada Medicaid and Infinite Campus to get our consent to release information for Medicaid reimbursement into Infinite Campus. And so we all should be or should have access to the one form statewide. That was my understanding. Are you saying there's going to be a different one coming out?
I think that may be similar, but I've heard from some LEAs where getting that data to cross over from Infinite Campus to their vendors that they're using for EHR or billing, there's a barrier there in getting that pulled over to their systems if it's different. Okay. And we may be able to have, like, once we're able to send out and share that form, have like a mini session to discuss any questions too, if specific things come up. Okay.
And have you been in discussion with NDE as well regarding that form?
Yes, we were going to have Monica Romero speak today, but she's traveling for the mental health summit that's tomorrow.
But does she work closely with, I forget their new title, the Office of Inclusive Education? Because that's also part of our IEP template.
I can follow up with you on that one.
Thank you.
Yeah. Okay. So this next slide has some resources and tools, and there's links here. I will share the slide deck. That way you guys can click on the links and actually access them. But we are going to continue putting resources on the School Health Access Resource Center, which is the website that I'm updating. But there's also a lot of great resources from the School-Based Health Alliance. They even have a short YouTube video that breaks down the difference between FERPA and HIPAA in plain language that could be used with families. That could be really helpful, along with their fact sheet. And actually, the new form that we had been working with NDE on that could be the statewide release of information for Medicaid. The part of that template came from these folks as well. But let me see. Next, I just want to open it up for any questions that anyone may have. You can feel free to raise your hand, unmute, and just talk, or put things in the chat. Either way is fine with me. And if you think of something later, you can definitely reach out to me through email. And I believe the next slide has my email. There we go. All right. Monica, it looks like you're going to say something.
I was just trying to come off mute. I'm sorry. I just wanted to say thank you for putting this together. I know the FERPA and HIPAA question is not going to be put to bed with this, but I'm hopeful that it will help provide some information and some support for everybody. So thank you very much.
Thank you. Gina, nice to see you.
All your resources too. I just wanted to ask a question, and sorry, I was kind of multitasking. It was brought up in a class that I was taking about the release of information and consent and how it doesn't have to be for all. It could just kind of be piecemealed, and what your thoughts were on that, and if you had any examples.
Can you elaborate what you mean by not for all? Unless I misheard you.
No, you're fine. So let's say, for example, they want to do a release of information, but they don't want to release all of the information. So the parents are hesitant about signing consent forms.
I see. That is a good question. Generally, from my experience working in the healthcare field, if someone wanted to exclude a certain portion of their data, then they would just write that like as such in their form. But if that's a scenario that you guys are seeing come up, I would love to kind of look at the specifics in that and dive into that with you guys, because I haven't heard of that happening with this specific release of information consent. But yeah, definitely email me if you want to like dive into that more. And I'm going to look into that as well myself.
Okay, thank you.
Alrighty. Well, thank you all for joining and your participation. I appreciate your time. Next month, October 21st, we are going to be having a information session on assessments. We are going to have the chief nurse from Clark County School District and the chief nurse from Humboldt County School District, along with our behavioral health clinical advisor, Dr. Pebbles, speaking for that session, and I'm very excited and hope to see you all there.
Thank you.
Thank you. Have a good one.